Ashley Davis, and this is Hospice House Call. Now, on this episode of Hospice House Call, I want to talk about the history of hospice. However, first I want to start off with talking about death and dying, because it's my belief that as a hospice professional, we have to get really comfortable with talking about death. And in order to understand that, we have to look at our own perception and society's perception of death and kind of how that came to be. So on this episode, we're taking a little field trip. Today, we're going to talk about death. We're going to talk about death a lot, because as hospice professionals, that's just what we do. We talk about it, we see it, we deal with it, we help families talk about it and see it and deal with it. So we have to be really comfortable with death, which is why I brought you here. Death is all around us. It's just the circle, the cycle of life. Us as hospice professionals, we're a little more comfortable with it. We're a little more familiar with it. We're a little more educated about it. Community at large, not so much. And I'm going to tell you why, and that's what we're going to talk about today. History of death and dying, the history of hospice, and our perceptions of it in our society today. To start off, I want you to do an exercise. Now close your eyes and imagine that you're with a patient and a family, and they have days to weeks to live. Now you understand this as a professional, you understand the signs and symptoms and what to look for. They really don't see it coming, but you have to talk to them about it. So you have to say the word death. You have to say the word dying. You have to ask the family and the patient what they want when they're dead. What kind of arrangements do they want to have? What kind of death do they want to have? You have to say the D word and get really comfortable with the D word a lot. Now, for more seasoned hospice nurses, this is a little easier, but for the new hospice nurses or new nurses coming into the hospice field, this can cause a lot of anxiety. However, the D word, not that D word, the other D words, death, dying, dead, those are all words we have to get comfortable with. Because if we're not okay talking about it, how are we going to talk to our families about it? And how are we going to get them talking to each other about it? The D word is something that we are going to have to talk about a lot in this field. And in order to understand where the families are coming from and why this is such a difficult topic, and why it's a difficult topic for us, we have to understand the history of death and dying, our perceptions of it based on that history, and the history of hospice as a whole, and why it's important. So people have been dying for a long time, like since the dawn of time. And since the first death, people around them have had to learn to take care of the dying and the dead. In the Middle Ages, crusaders who were sick and wounded would go to monasteries and convents to be nursed back to health. However, that was very unlikely at the time, so the monasteries and convents were really places for them to go to be taken care of as they were dying. In 1633, St. Vincent de Paul started an organization that was dedicated to taking care of the sick, the poor, and the dying. And then moving into the 1800s, Our Lady Hospice was founded in Dublin, Ireland. These were the first hospices and really the first GIP units of the time. So now, let's talk about death and dying and how that looked in the 1800s. So in the 1800s, the life expectancy was really low and the mortality rate was really high. At the time, someone can expect to live to the age of 35. Now, that would make me a golden girl. I'm more of a Sophia myself, but I digress. Hospitals were really a place for poor people or for sick people with nowhere else to go. If a birth or a death or even surgery needed to occur, that happened in the home setting. People lived in rural areas, so they lived with animals, lots of animals. They were exposed and took care of chickens and pigs and ducks and cows. So they saw the cycle of life all the time. They saw the animals being born and they saw the animals dying. They were really involved with that. Not only that, but Grandma and Grandpa, Mom and Dad, and the kids all lived under one roof. That meant when Grandma got sick, you didn't send her to Shady Pines, she stayed home with you. So high mortality rate and low life expectancy meant many deaths. It was not uncommon for someone to experience several deaths of people in their family by the time they were my age. And dying, like birth, was considered a natural event. It was just part of the cycle, the circle of life. And it was a family event, an event that involved everyone in the family, from the smallest child to the oldest. It was also one that was spiritual and religious, again involved the entire family. So that meant when Grandma got sick, everyone was also expected to take care of her and to sit with her as she was going through the dying process, and again to sit with her until the wake. Now the wake happened in the home. It happened in the parlor room of the home, and the whole family was involved, and the family is the one that held it. It wasn't until funeral homes came along, and that's where we got funeral parlor, was from that parlor room. Funeral homes came along and started taking care of this for the families. Now when death occurred, the wake happened in the parlor room, and the family would go and bury the body on the land. The family took care of all of it from the dying process up until the death and taking care of the funeral arrangements. So the family took care of the body during the funeral. They also took care of the body when it came to burial, which usually happened right on the land. However, let's say you did get sick and need to go to one of these hospitals. Due to poor sanitary conditions and risky medical procedures, your chances of surviving there were very slim. The hospitals at the time actually made the mortality rate a little bit higher. Let's be honest, they had no idea what they were doing. One practice in particular, the practice of bloodletting, is a good example of this. A doctor thought you had a disease, would come over, let a few pints of your blood out, and you were cured. George Washington probably had what we would call now strep throat. His very best doctor came over, let out 4 or 5 pints of his blood, and voila! No more strep throat, and no more George Washington. And bloodletting was not only done by doctors, barbers were specialists in this activity as well. Hence the red stripe on the barber pole. You see, barbers had the tools for this job, so they were the man to call if you needed some blood let out to cure your strep throat. Now, imagine one trip to Great Clips and you can get your hair cut and have half of your blood let out at the same visit. Sounds practical to me. So if you were sick and needed a place to go and the hospital was your last resort, you could find that the sanitation practices there and the medical practices really weren't up to par. They only added to the high mortality rate. That was until a wonderful nurse named Florence Nightingale came along. Now Florence was great in a lot of ways. She did a lot of revolutionary things for the medical field and in the hospital setting. See, she thought that opening the curtains and letting light in and fresh air in would help the soldiers at the time, her patients, heal and help with depression and elevate their mood. It was a trick that worked. Another thing she suggested, which was a novel idea at the time, was that doctors who were performing surgery wash their hands before going to deliver a baby. Now that was a bold move at the time for a nurse to tell a doctor, hey, you might want to wash your hands, but it was one that paid off. With that practice catching on more and more, the mortality rate started to go down and the life expectancy actually started to go up. A little, but hey, it was a start. And then the turn of the century. Life as we knew it would never be the same. The Industrial Revolution. It revolutionized every industry, including the medical field. Along with aseptic technique and hand washing improving the medical field, along came x-rays, vaccines, antibiotics, chemotherapy, the list went on and on. It soon became safer and safer to go to the hospital when you were sick or when you needed to have a baby. Also, more and more women were going back to the workforce. Thanks, Rosie the Riveter. But what that meant, that no one was home to take care of Grandma when she became too sick. So, to the nursing home she had to go. This meant more people going into the hospital when they were sick and more people going into the nursing homes when they were too frail, meant that no one actually got to see death anymore. The families weren't exposed to the dying process. They didn't know what to expect and they didn't really know what to do when death did come. Back again, home sweet home. So up until the 50s and the 60s, the medical field got really good at prolonging life. So anyone with a medical illness that was deemed incurable, that there was nothing else that could be done, there wasn't much effort that was going to be put, medical attention anyway, that was going to be put into their care. They could go into a hospice, but hospice was really just a place to die. It wasn't really about treating people at the end of life or treating symptoms, managing symptoms. It wasn't really about the quality of life. It was really just a place to go to die. So up until the 50s and the 60s, the medical field got really good at life prolonging measures, and it was getting better and better every day. However, because it was getting better at prolonging life, it was getting really bad at treating death. And us as a society, we no longer understood death and the dying process, or how to take care of it, or how to manage it. Hospice at the time was really a place to die, and it didn't deal with the quality of life. It didn't deal so much with the symptom management. There wasn't a lot of research done. Once someone's medical illness, once someone was deemed uncurable, that's really all the medical attention they were receiving at the time. That wasn't until Dame Cicely Saunders came around. Dame Cicely Saunders was a nurse turned social worker turned MD. She was really the whole IDT in one person. But she was working with cancer patients and in a hospice, and she saw that patients needed better symptom control. They needed better pain control. She saw that death wasn't just about the physical pain, that it was spiritual and emotional pain, and there were psychological and psychosocial issues that both the patients and the families needed support with. In the late 1960s, Cicely Saunders came to America and gave a lecture at Yale University. In attendance was Florence Wald. At the time, Florence, who was an RN, was the dean of the nursing school. And so Florence is listening to Cicely Saunders give this lecture about the hospice model that she had developed over in England. And Florence was so moved. And she also recognized that end-of-life care was important. She also saw the need that we had here in America. So after that lecture, Florence Wald and a few other volunteers worked really hard, even with a lot of pushback, but they were able to open the first hospice in America, Connecticut Hospice in New Haven, Connecticut in 1974. Now, people saw that this was something that was needed here. They saw the importance of it. They saw the holistic model of care. They really got on board with it, and by the early 1980s, Medicare even made it a benefit. After that, a bunch of facilities opened up, making hospice care more accessible to more people. Now, that, in a big, gigantic nutshell, is hospice care, the history of death and dying, and really the history of hospice. So, why bring it up? Because while hospice may be more accessible, and people are more aware of the need for end-of-life care, there's still a misconception that death is unnatural. People still don't know how to deal with death and the dying process. So it's important. What we do is important because people do need that. They need that guidance. They need someone to show them the milestones of the dying process and to help them with the arrangements. And not just that, but to make that time special and meaningful and memorable, and to help the patients leave a legacy that they want to leave. But in order to do that, we have to talk about death. We have to say the C word to a cancer patient. They're okay with it. A lot of times patients with cancer, they know they have cancer. A lot of times, and the less you're able to say it to them, the more awkward they're going to feel. The more of an outcast, the more of a medical failure they're going to feel. You have to be able to say cancer to them. You have to be able to say the D word. You have to be able to say death, dying process. You have to be able to say these things, because if you don't talk about it, they're never going to get to a place of understanding. And if they don't get to a place of understanding, they're not going to get to a place of acceptance. And that's not the kind of grief or bereavement we want people to have to go through. So if we don't talk about it, that's another D word. That's denial. And we don't like denial in hospice. You'll soon find out if you don't already. Although receiving the 6-month diagnosis can be a terrifying thing, there is a beauty in it. There's a silver lining in it. You see, when you have a timeline or a death sentence, you're able to live a lot more powerfully. You're able to live with a lot more enthusiasm. You're able to the things that upset you probably aren't going to upset you anymore. And the things that you want to do, you're going to experience. Think how much differently you and I would live our life if we were told we only had 6 months left to do it. How much passion we would have for the things that really deserved our attention. how different our conversations would be, how much more meaningful our time would be spent if we had a timeline. So yes, it is tragic and it is sad, and we are there for them for that, but there is a sense of hope to it, and there is a silver lining to it. And I think that that's something that we need to help facilitate in them, is the time that they have left to make it the most beautiful, most memorable, and most important time in their whole life. And when it comes to preparing for death, we have to say the D word. I think I'm going to title this video, "We have to say the D word." We have to talk about it, and we have to get them talking about it. Because once we get them talking about it, then we can help them orchestrate a beautiful death. We can help them create a wonderful, lasting legacy. We can help the families get to a place where they're effectively coping and they're ready. So if we do nothing else but facilitate a sense of understanding and acceptance that death is not a medical event, it's a natural part of life that involves the whole family, and it's a spiritual one, then we've done well. And if they can make peace with that idea, we've done even better. So I want to read you a quote from Dame Cicely Saunders. "You matter because you are, and you matter to the end of your life. We will do what we can do, not only to help you die peacefully, but to live until you die." And that, my friend, is the hospice philosophy. So, high mortality rate, low life expectancy meant that people were naturally just going to be exposed to death.
Death.
So, high mortality rate and low life expectancy meant many deaths. It was not uncommon for someone my age to experience many deaths by the time they were my age.
Oh yeah?
Shut up! This is not easy. Doctors in the 1800s were a little less qualified than they are today. Okay, let's be honest, they had no idea what they were doing. One practice in particular was the practice of bloodletting. A blood will let your doctor.
Blood, let the doctors let the blood.
Blood let the doctors let the blood. George Washington probably had what we would call now strep throat, and a wonderful doctor came over, let out 4 or 5 pints of his blood, and voila, the strep throat was cured. No more strep throat and no more George Washington. Alright, how was that?
Go back to voila.
Voila!
Just say voila.
Okay. Many doctors at the time, I understand. Where did I voila at? Alright. The Industrial Revolution actually revolutionized everything. Nope, that's not how it starts off.
You'll be so far away, and yet.
It's so loud.
Damn Industrial Revolution.
The Industrial Revolution.
Yep.
Also, more and more women were going back to the workforce. Thanks, Rosie the Riveter. But what that meant, that no one was home to take care of Grandma when she became too sick. So, off to Shady Pines, Grandma went. That sounded a little harsh, huh? And the medical field as a whole could do a lot better when it comes to referrals to palliative and hospice care. And I think that with policy? But why do we need to get there, Ashley? Final take. So if we can do nothing else but other than facilitate a sense of acceptance and peace, not final